Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health Result. My today's topic is mumps, that is inflammation of parotid gland. So in today's topic, we're covering everything about mumps, parotid gland inflammation, infection. So you're requested to watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel for further notification. So let's start with definition. Mumps. So mumps is a kind of viral infection of parotid gland. Parotid gland, these are the glands, salivary gland. These are in pair, like there are 3 salivary glands pair, and these are sublingual, submandibular and parotid glands. And all these glands have duct and they open in the mouth and they form saliva. So they help in deglutition, swallowing the food. There is any kind of inflammation of this gland due to virus infection, so there are problems like swelling of gland, and there is dysphagia, difficult swallowing, difficult deglutition, and this usually occurs in childhood, in children, and the children who are not vaccinated, fully vaccinated. The cases are very less nowadays because there are good vaccination program, but still cases are seen. Now, what are the causes behind this? As this is a virus infection, how does it spread? The spreading part, this is an infectious condition or contagious. So the kid who are not vaccinated, they can catch the infection from the infected kid. And how? By coughing, sneezing. So there are virus particles in these cough, a droplet. So once the unvaccinated kid touches or anyhow touches the surface that has virus landed on that surface, so they are touching that, and from the direct contact, by inhaling these virus, so they catch the infection, they get the infection. But if the kid is vaccinated, so they don't have any symptom or they have very mild symptom. Moving on with symptom part. What are the symptoms of mumps? If the kid is vaccinated, so yes, they are having good immunity, and so they don't develop much symptom. They may have milder symptom. But if the kid, they are not vaccinated, they are not fully vaccinated, and they have poor immunity, they may develop these symptoms. And yes, after the virus, it takes time to develop the symptom. Usually it start after 2 or 3 weeks of virus, and swelling start initially, but the symptom appears later on. And these symptoms are, as this is a kind of flu infection, so flu-like symptoms will be there. There will be fever, malaise, body ache, weakness, and difficult swallowing. And if the case is severe one, so they are having swelling over the front part of the ear, and that is very tender, very painful to touch, and difficult swallowing, aversion to eat, because that becomes difficult. You can manage at home. This is a kind of virus infection that goes with time, that subside with time. But you can even do compression. You can do warm compression as well as cold compression to relieve or to ease the swelling. And yes, there are medication in homeopathy, we'll talk later on, is suggested as much as possible. Complication part. This problem has the complication. Mumps has very serious complication. So you are requested, you are asked to get kids vaccination, the childhood program, the fully vaccination. There are schedules we'll discuss. So complications are there can be hearing loss if the condition is severe and you're not having the treatment part. So yes, this can cause hearing loss. And if the virus is spread to other body part, if this is spread to the brain, this is like a inflammation of brain, and this is encephalitis. And in encephalitis you have seizure, there are convulsions, fits. And if this virus is spread to the brain membrane, these are meninges, so this causes meningitis. So virus is spread to pancreas, then there is a pancreatitis, and sometimes after puberty this virus is spread to the testicle part, so there is orchitis, and later on this may cause infertility issue. In female, this the virus can spread to the ovaries, and again this can cause similarly euphoritis, and again there are problem with conceiving, infertility issues are there. So there can be certain complication of mumps. Prevention part. Prevention. Yes, as discussed, nowadays this is not as common as earlier. Why? Because of the vaccination, good vaccination routine. So the first step to avoid this vaccination, and nowadays these are combined vaccines. These are MMR, mumps, measles and rubella. So this is a combined after having these vaccine, there are less chances of having all the symptom of mumps. Homeopathy helps you in treating mumps. There are different medicine depending on the individual symptom, individual case history, and you are not supposed to buy or use all the medicine, not required. These are on the symptom basis, on side base, which side you are having, and gender based, and after puberty, or what other symptom you have. These are the medicine. And if you're watching on YouTube, you may find all medicines link below in description box. You can buy medicine and you can start your treatment. Pulsatilla. Pulsatilla is the medicine in homeopathy that treats mumps problem, that you catch infection after puberty. In boys, this may cause orchitis, so this treat that problem, that complication part. And in female, in girls, yes, they have ovaries infection, ophoritis, so that treats ophoritis as well. These are the oral medication. You're supposed to use these medicine orally, and you may find the different color of the medicine. Just focus on the medicine name. Quantity can differ, even color may differ with the brand or with the company, the place you belong, and even the form of the medicine may differ. You may get medicine in the pills form, so just focus on the medicine name, that is Pulsatilla. So if it is in the liquid form, just take 1 or 2 drops 1 or 2 times before having your meal. And as these are homeopathy medicine, so just use regularly 2-3 weeks or onward. It depends. Chamomilla. Chamomilla in homeopathy used in treating mumps cases where there is anger issues, irritability are there, and very severe pain. So this is known in homeopathy as a painkiller, as a pain reliever. So this relieve your pain. So if the pain is severe, you can use chamomilla. Same way with the help of dropper, 1 or 2 drops 2 or 3 times in a day before having your meal. Ballerina is known as an anti-inflammatory medicine. So this reduces your inflammation, this reduces your swelling. And with redness, with there are swelling. With swelling, you have redness, remarked redness, and there are heat, and headache is there, throat pain are there with ballerina. So all the symptoms, throat pain, headache, and fever even. So again, with the help of dropper, 1 or 2 drops 2 or 3 times in a day before having your meal. Mug salt is used in homeopathy in parotid infection or mumps cases when the gland on the right side is affected. Right side parotid gland swelling treated by mug salt. On the other hand, lacasis is given in the left-sided parotid gland swelling. So you can take lacasis. Same way, 1 or 2 drops 2 or 3 times in a day before having your meal. Apis mellifica. Apis mellifica is known in homeopathy for reducing swelling part. If there are swelling, there's edema, and there are burning pain, stinging pain are there. So apis mellifica is given. And apis even treats your brain infection. If you are having brain inflammation, that is encephalitis. So apis mellifica treats that part also. Patent medicine Dr.RUkmani R1 drop, that is inflammatory drop. So this is in general. This has multiple medicine in it. So you can use this medicine as well. This is in the liquid form. So just take 5-10 drops in some lukewarm water 2 or 3 times in a day before having your meal. Hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep supporting. Thank you so much. Thank you.